So my first thoughts were to try and explain to everybody, my friends and family, that this was quite a serious thing. I remember having a discussion with my husband about whether we should go away for the weekend. And I said to him, I really don't think we should do this. I really don't think we should be traveling, and I don't think we should be staying in a hotel. And he was sort of really reluctant to lose the deposit on the hotel room, if you like. It wasn't that he didn't see, he just didn't quite see how important it was going to be. So fortunately, the decision to close everything was made for the weekend when we were supposed to be going away. So I didn't have to win the argument in our family, although it turned out that I was correct in my thinking. My other thought was, as I mentioned, I'm a fellow of the Institute of Biomedical Science, and I actually am a registered hospital diagnostic virologist, although I work at the university now. But my other thought was, what can I do to help? And I'm sure lots of people thought that in whatever their skills and talents and abilities were going to be, well, how can they help us get through this thing, this sort of national or international crisis? Not that we really knew this time 3 years ago what was really going to happen, but the idea that it was going to be something that we possibly never experienced before. And I think most people's instinct was to try and do whatever they could to help the people around them and to try and help all of us get through it.
Okay, and obviously, as the past 3 years have unfolded, we've seen various waves, various variants happen. The virus has itself changed. Is that broadly in line with what you expected would happen, or have there been any surprises along the way?
No, I don't think anybody expected the virus to do what it did. It's been absolutely fascinating. It's been heartbreaking because at least 7 million people have died from COVID across the world. So it has been an absolute tragedy. But from a scientific point of view, it's been absolutely fascinating to watch the virus change so quickly. It's not something that normally happens, even though the COVID virus is a type of virus which is prone to mutations, a bit like there are other things like flu and Ebola. They're all the same type of makeup, which makes them prone to mutation. But we haven't seen anything changing in so quickly and so drastically in the way that the COVID virus has done over the last few years. So I don't think anybody expected that. So we've almost been just watching it change and trying to respond to the changes the virus made rather than predicting what it was going to do next, because that turned out to be a really silly idea because you didn't know what the virus was going to do next. And we can say now that Omicron, 98% of all the isolates which are being typed from all around the world are Omicron now. So it's sort of settled Omicron for the time being, but whether it'll change again, nobody really knows. It might settle down at Omicron or it might change again. We don't really know yet.
Okay, and obviously, as we mentioned earlier, it's the third anniversary of the start of the first lockdown. Obviously, that was something that most of us have never experienced before. It was quite a new thing for all of us to get our heads around back then. Looking back, what are your thoughts on that lockdown and the couple of subsequent ones that followed? What kind of a difference did they make, and were they ultimately the right thing to do?
Yeah, so as you said, nobody's experienced that. At that point, it was 100 years since there'd been a previous global pandemic, which was the 1918-1920 flu pandemic. So none of us had really knew what was going to happen. But of course, lockdown was a really important tool. It was the only thing we really had, because we know that it spread through coughing and sneezing and hanging around in the air. So, and it's, as we've seen, it's super infectious. So the only way to stop it spreading from person to person is to keep people away from each other, which was the point of the lockdown. At that time, we were nowhere near having a vaccine. The fact that we got vaccines within 12 months was a minor miracle of science. Sorry, a major miracle of modern science. But we didn't, this time 3 years ago, we didn't know that was going to happen. We also didn't really have effective treatments for people when they got into hospital. That did come with time, but in the beginning, we didn't. People were going to hospital, and there wasn't any treatment for them apart from to try and give them lots of oxygen, and trying to keep them breathing. So the point of the lockdowns was to stop the virus spreading, so to keep people safe. And there have been 7 million deaths around the world, or officially recorded deaths. But if we hadn't have had lockdowns, there would have been many, many, many more, many times more than that 7 million. And so it definitely saved lives, and it was definitely the right thing to do. It did seem very drastic, but that was the only tool we had in the box to stop the spread of a super infectious respiratory infection.
Okay, and you mentioned there the vaccines and the treatments that have come since. Just tell us a little bit more about those. What kind of a difference have they made?
So, and I was saying this all during 2020, that the previous record for getting starting from the beginning and developing a vaccine, getting it through all the clinical trials and getting it into the arms of the general public was 4 years. And that was for a mumps vaccine, which mumps is a virus we've known a lot about for centuries. So I really thought that we wouldn't be able to get a vaccine within 12 months, even if at all, because people had tried to make a vaccine against the SARS-1. They tried to make a vaccine against the relative virus, the Middle Eastern Respiratory Syndrome virus, and had not been able to manage to do that up until that point. But so, as I said earlier, it was a major miracle of modern science that we managed to get a vaccine. And not only did we got several candidate vaccines that all went through clinical trials within the year, and quite a few of them passed all their clinical trials and were able to be used on people. And we were vaccinating people by the Christmas of 2020. That's made such a difference. Again, it made it possible for us to gradually, slowly open up and get back to some kind of way of living normally. Of course, all the vaccines that we've got so far don't stop you getting COVID altogether, but they do reduce the chances that you're going to get COVID and you'll get serious illness. It has prevented a lot of people from getting into hospital, and also has prevented the spread of the virus to some extent. It does, even if you've had the vaccine, you can still get COVID and you can still pass it on to other people, but the chances are lower because you've got some protection from the vaccine. So it's made a huge difference, and I don't think we would be getting back to some level of normality that we are at the moment without the vaccine. And by that I mean across the whole world. Of course, COVID is still about. I've personally know of people who've caught COVID in the last couple of weeks, but the vaccines have made a huge difference in our human beings' relationship with the virus. Is sort of, there's the vaccine is in between that, so it allows us to keep the virus under a bit more control than it would be otherwise. And similarly with the treatments, people managed to develop those sort of in real time. As patients were coming into the hospitals, they were just trying different types of drugs which were previously available. There were antivirals which they tested, but also just very standard steroids and other sorts of drugs which were just used for general treatment, and found that some of those were really very effective. But of course, that was just through trying them out in real time on patients when they were in hospital. But the fact that some of those worked also made a huge difference later on into 2020 and subsequently, because we do, even if you are unfortunate enough to get very serious COVID and ending up in a hospital, there are now treatments that we can give to you to try and help that you do eventually recover.
Okay, and just tell us a little bit about the situation that we're in now, three years on. So obviously, most of us have had at least one course of the vaccine. Quite a lot of us have had COVID at one point or another, but it's sort of gone a little bit out of it's gone quite a lot out of the news and out of our sort of daily thoughts, if you like. But how much should we be still considering it, and still, what would be your advice to people about protecting themselves with the situation that we're in at the moment?
So the situation we are in from the global point of view is there have been 700 million recorded cases of COVID across the world in the last 3 years. And as I said, almost 7 million deaths. But equally, there have been 13,000 million doses of the vaccine given out across the world. It's amazing. The numbers are amazing. But COVID is still around. It's the Omicron variant that a lot of people probably have had that. If you've had COVID in the last year, you will have been infected with the Omicron variant. It's super, super infectious. The vaccines that you've had will give you some protection. The fact if you've had vaccine and a dose of COVID, that does seem to give you a bit of an extra protection, but it doesn't, none of it lasts very long. You're not going to be protected for life. So the point is to still be very cautious and very careful. If you have symptoms which seem to be COVID, some of us still have tests available. Some workplaces are still testing people, of course, and you can buy the tests in shops, but they're expensive, so not everyone's testing themselves. But if you have symptoms which seem as though they might be COVID, do take it gently yourself, because it isn't very nice. Take some time off work to just rest and give yourself a chance for the virus to work through you, so that you don't end up very seriously ill with it yourself. And also be very cautious about who you come into contact with. So try not to visit your elderly and clinically vulnerable relatives and friends at the time when you have those symptoms, because it might be COVID, it might be a cold, but equally you shouldn't really be giving your elderly and clinically vulnerable friends and relatives even influenza or even a cold, really. So do take it very gently. But also, if you know that you've been in close contact with somebody who does have COVID, but you don't have the symptoms and you think you're fine, just be a little bit careful, because we know that the things that we know about the virus haven't really changed. So 1 in 3 people who have active COVID infection don't have any symptoms, but they could still pass it on to other people. So while I'd say, I mean, I don't really wear a mask in enclosed spaces anymore in shops or that sort of thing. If you're going for a healthcare thing, an outpatient's appointment, or I mean, I'm going to see a physiotherapist next week and they're requesting that you wear masks in those type of environments. But generally, people are not wearing masks in enclosed public spaces, and I'm not really anymore. So that. I'm not, I'm just saying, just be aware of the fact that COVID is about, and just if you do have COVID-like symptoms, just be very cautious and don't assume it's a cold. And even if you're young and relatively fit and healthy, don't assume that you'll be fine. Do look after yourself and just be careful of the people around you as well.
Okay, great. And I suppose just finally then, and this is probably quite a tough question, but where do you see things going in the future? So what could potentially happen with COVID in the coming years? And I suppose ultimately, will we ever be able to totally forget about it? Will it ever potentially disappear completely?
I don't think it's ever going to disappear completely, not now, because it spreads so widely and it's so super infectious and it's really difficult to control it. So I think COVID will be around probably forever now. What we don't know is whether it's going to finally settle down. We've talked about the variants, and we've had alpha, beta, delta, gamma, several others, and we're now at Omicron. And there's about 6 or 7 different versions of Omicron as well. So the virus is still changing, but at some point in the future, and it could be several years away, it might settle down into being one variant it's the same variant all around the world all the time, and then it becomes predictable. And then we can say this is what COVID does, and we can now say, like we do with other viruses like influenza or measles, we know how that virus is going to behave. We know what the seasons are going to be. We can develop a long-lasting vaccine against it, and we know what it is. We can give people advice about how to avoid it, based on what we know the virus is going to do. We're definitely not there yet. up until this spring, we've always had a big outbreak in March, April time. So obviously the first wave, but then also in 2021 we had Delta, and 2022 we had, although it was Omicron had started at Christmas, we did have a really big wave across the whole, certainly across Europe and North America in March. And I was really expecting to see that this March. So far, thankfully, that doesn't appear to have happened. There was a little bit of a spike towards the end of February, again across the whole of Europe, and it seems to be settling down. And now we're just getting, people are still getting COVID, but it doesn't seem to be quite as much of a problem as it was this time last year, for example. So I still think that because there are a lot of, anecdotally, there's a lot of COVID about, I suspect that it might settle down to say that there are two COVID seasons. There's March and there's sort of Christmas time. And if that, because that's what we've seen so far, if that's how it goes, then at least we'll know that that's what COVID is like, and we can expect lots of cases at spring, Easter time, and we can expect lots of cases at Christmas time, and we can sort of be prepared for that. And if the virus properly settles down, the scientists can start developing a more long-lasting vaccine, because the ones we've got at the moment were absolutely the right thing to do, was just target one bit of virus, which was the spike protein that your listeners will remember. But it doesn't give you long-lasting protection. It's going to take a bit more time and a bit more research to actually develop a vaccine that will give you lifelong or protection that will last for, let's say, 5 years or something. That will be the ideal thing to get to. But I think we've got to wait for the virus to settle down a bit more before we can start working on that, because if we're not careful, the virus will have changed so much. By the time the vaccine's ready, it's not going to be that much use. So we do need to observe what the virus is doing and we're not going to be able to stay a step ahead of it. We need to be as close behind it as we possibly can until it properly settles down. I would hope that in a few years' time, it will be just another virus that we have season, like norovirus. We have seasons of norovirus, it's winter vomiting virus, although across the UK, there are quite a lot of hospitals that have got norovirus now. And then we just go, oh, that's norovirus. We know what that is, and we know how to deal with it. So I suspect that we'll have outbreaks of COVID. People have talked about it becoming endemic. And I don't think it won't become endemic. Endemic means it's entirely predictable and, as you say, below the radar and nobody really bothered about it. I don't think we'll see it to be like that. I think it will be much more like norovirus, where we'll have these big outbreaks and then it'll sort of die down, which is what we've seen so far till now. But we hopefully, in a couple of years' time, we will be able to predict when those outbreaks are likely to occur so that we can be ready for them. But nobody really knows, because this is such a new virus and it's done so many unpredictable things in the last few years that it's really, really difficult to be absolutely sure. But that's what I hope will happen. And then we will at last be able to kind of live in, not necessarily in harmony with it, but we'll live alongside it, so that it's never going to go away. It's always going to be something we should be concerned about and worried about. But we will live alongside it and be able to carry on with our lives anyway. It won't be on the news as much as it has been. That at least we can say that. And there'll be a big outbreak in, let's say, Newcastle, and it'll be the headline news because it'd be so unusual. That's what we're sort of wanting to aim for, isn't it? But it could be another 12, 18 months before we actually get to that point.